Good afternoon, class. Today we are looking at oral care in a patient who is unconscious. So we'll show you the steps that you can do. For example, if we give you to do it in a scenario for OSC, we'll show you how you can do it very fast so that you're able to gain higher marks. So let's start. The way we start with procedures, as usual, hand washing. So OSC and washing just have to be quick. Put soap, 1, 2, 1, 2, 1, 2, 1, 2. So meaning for OSC, that's the hand washing. Okay. Then as you dry your hands, you go to the patient. Good morning, Mr. Mulenga. I am student number 2. I have come to do oral care on you. May I please go ahead? Okay, the patient has said I can go ahead. So what about where you're sleeping? How is it? So this, in the cases where we're saying unconscious patient, the patient won't answer. But at least it's important for you to just explain what you're doing and give them at least the real scenario of what will be happening. Because we always know that the sense of hearing goes last. So this patient is unconscious, but we have explained. Even where they're sleeping, okay, we have checked. So meaning assessment done. So at this moment, you're coming to do the actual procedure. So you're looking at what you have. Bottom shelf, I have sodium bicarbonate, which I'm going to use for cleaning the teeth. Then I've got an incontinence sheet and a pair of gloves, which I'm going to wear. Top shelf, I have the orange sticks, which I'll use to clean in between the teeth. Then I have a spatula, which I'm going to dress it to act as a bite block or just to use it for cleaning. But in this case, I'm going to use a spatula as a bite block. Then cleaning, we'll use a forceps, which will be padded as well. Then here is gauze in this gallipot. And this is empty. We're going to put sodium bicarbonate. So let's proceed. So firstly, the gloves will be ready, which are there. Then the inco sheet is there as well. It's going to be at least ready. Then you start with sodium bicarbonate before you don gloves. You put, okay. Thereafter, you don the gloves, which I've prepared in advance. So these are not sterile gloves, they're just examination gloves. Okay. Okay. So after that, you can cover the patient using an incontinence sheet. So incontinence sheet there will be put. Then since this patient is unconscious, you want to tilt their head on the side. So the patient's head will be tilted on the side like that. They'll face this other side. Okay. Next thing that you're going to do, you're going to now dress up the forceps. So it will be dressed like that in readiness for cleaning. Then you're going to dress the spatula. So this should be the spatula, which should be dressed like that. It's a bite block in this case, so that the patient doesn't bite himself. Okay, so you're going to dip this gauze there in sodium bicarbonate so that you use it for cleaning. So the steps are that you begin with the bite block, which you put there. Okay, so when you insert the bite block, meaning you have an opening of the mouth there so that you can be able to see as well. So the first step is that you clean the hard palate in a side-to-side motion. So you go in like that with your forceps, then you clean side to side. Okay, so you go side to side until you reach a point whereby you cannot irritate the throat. Okay, so side to side. After you're done with the hard palate, which was up there, that's the hard palate, up. So you are doing side to side until there. Then you remove, you change gauze. You get another piece of gauze. So this you keep repeating. Every stage you have to change. Okay. So again, you go from the hard palate, which was there, you go to under the tongue. So you really need to focus. You go under the tongue. So under the tongue, you go side to side as well. Just go like that. That was under the tongue. So you keep repeating, changing the dressing there. So you go and change, you get another one, you dip it in sodium bicarbonate, you go on the tongue. So on top of the tongue, which is the tongue, the surface, you go side to side as well, like that. On the tongue, you remove and discard. Then you get another piece of gauze, you wrap it, then you dip it in sodium bicarbonate, you go from the tongue. Now you go to the inner surfaces of the teeth, so which is, these are inner surfaces, okay? So you go inner surfaces, so that's what you do. Inner surfaces and gums, do that. So you start from the top, you started from there, going this way. Again, that side, you go that way. Then you go down there, from the middle part, you go sideways, again, that side. Meaning you're done with the inner part. Then you remove, again, you throw. You get another piece of gauze from there, you wrap it, dip it in sodium bicarbonate. Then you go to the, from the inside now you go to the cheeks. So the cheeks there, you have to go like that. You go to the cheeks. From there, you can now even clean the gums. The cheeks, the gums, okay, cheeks, as well as the gums outside. So from there, even the teeth outside will be cleaned. So this side again, the gums and the cheeks. You go side to side, just like that, the gums and the cheeks. Then now you can finish off with the teeth on top here and down there, as well as the gums. When you're done doing that, you change again, you get another one. So the process still continues. You dip it there in sodium bicarbonate. Then you go on the grinding surfaces. So the grinding surfaces are these surfaces here. Here, the surfaces that chew, those are grinding surfaces. So you go on the grinding surfaces like that. Okay. Even this side, on the grinding surfaces until they are clean. Even this side, you go grinding surfaces. So the principle again will still stand. You can start from the top there, then you go down. So after you're done with that, now you can discard this, the faucet, and get the orange sticks. So the orange sticks will be dipped in sodium bicarbonate like that. Then you go just in between the teeth. In case something remained, you can do that to remove anything that might have remained there. So you can do that until you finish all of them. Then you can, if you think this is dirty, you can throw and get another one. Go down there and do in between the teeth. So as you do that, meaning you are done. You can even apply Vaseline on the lips. If you have Vaseline and if they like it, you can apply. And lastly, you can even now go to thank the patient. So you can say, thank you, Mr. Mlenga, for allowing me to do the procedure. I'm doing this procedure so that your teeth remain clean. Then another IEC that you can give, there's a point where you say, your teeth are supposed to be clean so that we prevent halitosis. You can even go to say to prevent gingivitis or just simply complications of the mouth. So thank you very much. Then at this moment, you can even go to the in charge and report. So you can go to the in charge and report to say that my in charge, I've cleaned Mr. Mlenga's teeth and I've left him comfortable. So after that, the last point that you must not forget after reporting is hand washing. So you need to hand wash. Every after procedure, we know that we're supposed to do hand washing. So remember to do hand washing. 1, 2, 1, 2, 1, 2, 1, 2. This is for OSCE only. Okay, not for word practice, only for OSCE, this hand washing. So thank you very much.